Alright, today we're talking about jaw pain, TMJ disorder. Let's talk about what's going on in the face, in your head region. We're talking about the mandible and where it interfaces with the skull, the TMJ, the temporomandibular joint. So the mandible goes up and it actually has two prongs. This prong is the one that goes into a joint right here, and this prong goes up under the cheekbone. You can feel this prong if you open your jaw wide, which I don't recommend if you have any problems with this, but you can feel it poke out. There it is. It's right under your masseter muscle. So the masseter muscle runs from this cheekbone, this zygomatic arch, and it goes down to the bottom of your mandible right here, and it's the prime jaw clincher. It brings your teeth together, and I'm outlining it right here. But it's got a friend, the temporalis muscle, which goes from up here down through the zygomatic arch, so it's dipping under your cheekbone and contacting this other prong right here. And if you clench your jaw, which I don't recommend if it hurts, you'll be able to feel this muscle up here jump out a bit. If you clench your jaw too much, you might start feeling pain around here, and you might feel yourself rubbing your temples. And that's just you knowing something about your body that you weren't aware that you knew. So the technique I'm about to show you is based on myofascial release, and it's kind of a combination of that and connective tissue therapy. But the main idea is to scoop and carry the tissue along with you, rather than pressing in and rubbing anything in particular. We're not trying to force the masseter muscle to get better. We are scooping the myofascia, the sheets of connective tissue that run over it, that run through our skin, that run through the deeper layers of our fat cells, and then also down into the muscle themselves, up into the connective tissue, and even into the bone. So if you're working with the fascia, you're working on a deep level. So we could press in and try to find trigger points, but really what I found to work best is what I'm about to show you. So again, we are not pressing inward, we are pressing upward. This is my angle of attack. We are pressing up toward the ceiling. And so go to the bottom of your masseter. You can use fingertips. This is what I like to use, but if you've got a lot of facial hair, or if this just isn't comfortable, you can try using the flats of your knuckles. It's different, it's a little more difficult, but once you get the hang of it, it's a nice broad surface and you might enjoy it. So go to the very bottom of your mandible and sink in just a bit, maybe 2 or 3 pounds of pressure. We are not going deep here. We are simply scooping the tissue and going up. And we aren't using oil right now, we're just using the oil that's on the face. Oh, by the way, you may want to wash your hands before this if you are acne prone. Don't want to cause any breakouts. And you might feel this a little in your neck. It's because all of this is connected. The fascia in your jaw, it's continuous with your neck, it's continuous with... Okay, I'm going to shut up because right now I'm going over the cheekbones, and I'm not stopping. I'm not letting up the 3 or 4 pounds of pressure, and it's okay that I'm not working directly on any of the jaw movers right now. That's fine. We are working on this fascia that overlays it and that runs through it. And now we are into the very bottommost part of the belly of the temporalis muscle, and you're going to come onto your temples now. And again, we're not sinking into the temples, we're just cruising over them. So don't apply too much pressure to the temples themselves, just keep cruising upward. And if you were to open your jaw wide right now, you'd feel that pull, but just let this be all that you do right now. You can work some jaw movement into this when you're more comfortable with the basic movement, but for now, this is good. And so now we're at the very top of the muscular portion of temporalis, and we're getting into the hairline, and the muscle keeps going on up into here, and it starts attaching to the skull up here. We're now onto the tendinous attachments up into the hairline. I'm betting I look kind of surprised right now. I don't know. And so we're now off muscle, and that's okay. We're going to keep cruising up. And if you were to do any sort of jaw movements, you might feel that extra bit of pull even though we're so far away from the jaw. So I'm not stopping, and this actually feels really good. You've had scalp massages before. They're awesome. You can do them to yourself. Just do this with the intention of giving yourself some freedom and of healing. And I talk about the intention of touch in another video. And check out your jaw. Move it around a bit. I'm hoping that you're feeling some tingling, some jingling, and just overall some extra freedom that you didn't have before. And after that, I just do a quick stroke downwards. I kind of outline the front and the back of my masseter muscle. Don't put too much pressure right behind the jaw here, just like the temples. You don't want to be sinking in too much, but you do want to be pulling down on that tissue. So 2 or 3 pounds of pressure, and if you can't find the exact front or back of your masseter, that's fine. This is about this connective tissue. So sink in just below the cheekbone, and with your thumb thusly and your fingers right there, and drag downward. And if you want to let your jaw open, that's just fine. Your face is going to look funny, but that's fine too. This is going to take 15 seconds. And get to the very bottom, and you're done. Now, check out your jaw again. I'm hoping that you feel even more freedom in that area. Now, this isn't going to cure any sort of dysfunction, but it will ameliorate some of the problems. If you do this every night before bed, hopefully you will clench less if you are a teeth grinder. And if you do it once when you wake up, hopefully it will set your jaw up to be in a better position through the day, and you'll be doing less clenching through the day. Alright, that's it. I hope this works out for you, and I hope you stop by again.